This disc at the L3-4 level.
Dr. Richard Kaul is a New Jersey doctor that is making a difference.
Strengthening of the muscles around.
In 2008, Dr. Kaul left his thriving spine practice in New Jersey to travel to Lubumbashi in the Democratic Republic of Congo, an area torn by civil war and domestic unrest.
And whilst I was touring around the clinics, the one thing that struck me was the very high, or the very large number of young men who'd been involved in accidents in the mines.
Dr. Kaul also came to the stark realization that spinal deformities and injuries had become a pandemic in the Congo, and there were no medical measures to correct these conditions.
Because of the manual labor, because of the many environmental conditions, we saw severe degeneration of these intervertebral discs, and the height of these discs had significantly decreased. And as that happens, that leads to an onset of back pain, and as you can see, a compression of these nerve roots, which leads to a variety of leg symptoms, which can include pain, weakness, and numbness and tingling.
In 2011, he came back to Congo, and on the second day at Panzi Hospital, a 17-year-old boy was brought in who had suffered an injury while playing with his friends.
He said that approximately 6 weeks before his visit to us, he was fooling around with some of his friends in his village. He was pushed, took a tumble backwards and in an awkward position into a ditch.
A few weeks between his accident and being seen by Dr. Kaul, the patient had lost all sensation in his legs and was relegated to a wheelchair.
But we knew that he had to be decompressed to enable the nerves to recover, to give them a chance to be decompressed.
Not being prepared with the tools that Dr. Kaul was familiar with in the United States, he used what resources he had to perform the surgery. The hospital anesthesiologist had to manually ventilate the boy as there was no access to a portable ventilator. Also, at one point during the surgery, the water and electricity failed for over 15 minutes.
The following day, when we went round to see him in the ward, he'd regained sensation in both his legs and he was beginning to move his feet.
These are the stories that inspire the team of the Spine Africa Project to relentlessly carry out this incredibly worthwhile initiative. The goal of the Spine Africa Project is to educate local doctors and implement proper techniques for treating and addressing these issues.
There's a huge amount of work that needs to be done to make, one, the mind safer, and two, to put into place spine protocols and provide proper spinal surgical care for these patients.
Dr. Kaul and his team will be making several trips to the Congo throughout the next few years and treating patients and using the latest and most effective American technologies.
We reached out to a number of the big spine surgical companies here in the States that we work with here clinically, and they've donated equipment, materials, implants, screws, all the tools we need to carry out the surgery out there. So we've shipped all of that stuff out to the clinic.
For more information, please go to www.spineafricaproject.org.
So I would ask anyone who sees this to go to the website and just to make themselves aware of what's going on out in this part of the world. And you know, with the Congo, sporadically the media will direct their attention towards it if there's a civil unrest, if there's, you know, sexual violence towards women going on. But it's important for us to see what's happening here in the mining sector and what's going on with the health.